Hi everyone. Hi everyone. Uh, Hi everyone. Hope you're doing good. So now in this particular session, I'm planning to discuss A to Z related stuff related to your ortho. Okay, what to be done, how to be done, where to be done, what are the things that you need to give utmost importance, what things has to be revised again and again, and the trend changes in ortho questions very specifically. And I'll be talking all related to ortho for your NEET and INICT preparation. So first and foremost thing, I want to introduce my team. Okay, the first comes is Dr. Gauri Shankar sir, uh, who is well known for his books and everything. Okay, he has more than 25 years experience in handling the NEET MDS as well as INICT MDS students, and he's the first one who has started the MDS based coaching center in the entire country, and he's an author of Dentist, which has more than 24 to 25 years experience. And of course the Dentist is the first NEET MDS based book. Okay, so we are privileged to have Gauri Shankar sir as a core team member, as well as a person who is going to handle the upcoming ortho subject. And next comes Dr. Usha, who has 6 to 7 years experience in handling NEET MDS students, and who is working with Team MDS Conquer from past 6 years, and the university topper of Indian University. She is an Indian University topper. And followed by, I'm just going to handle the game plan and the integration of ortho related to other subjects. So, okay, I'm privileged to have this golden team, and of course, you are going to have a best experience in handling the ortho in the upcoming few days. So next comes, basically I want to focus on like the number of questions that ortho is going to carry. So according to NEET MDS blueprint, which is given by NBE people, ortho is going to carry 14. Okay, but there will be few concepts of ortho will be integrated to other subjects. So I'm going to add +3. So it's going to turn around like 17 to 18. Because ortho is most often a time integrated to subjects like pedo. Okay, and it's more often integrated to dental materials, because there will be 10% of dental materials topics related to ortho will be related to your oral surgery as an orthognathic surgical procedures. And apart from this, there are lots of other subjects directly or indirectly related to ortho, like for example, like you talk about embryology. Okay, so embryology is again related to whatever the structures of bones, movements, all this, like biomechanics and everything like that. They're more often integrated here and there, but it is more exclusively related to pedo. Okay, right? Pedo and DM are the first and second priority according to me. And coming to INICT almost have the equal weightage for ortho, like maybe like 15 to 20 and sometimes more than 20, because we don't have a proper weightage system for INICT, because it is being handled by multiple bodies in handling the question paper and preparing the question paper. So it varies, but basically it's going to be around like 15 to 20, in and around like 15 to 20 or sometimes 20 plus. So this is what basically you need to handle. And why I'm stressing ortho is totally going to be a unique subject among the list of your 8 clinical subjects which are going to be in your part B. And I hope you know that your NEET MDS paper is being divided into part A and part B. Part A is going to be for 100 marks, and part B is going to be for 140, and part B will be focused more on your final year subjects, your 8 subjects. And out of these 8 subjects, definitely the unique subject is going to be ortho is definitely a unique subject. The reason why I'm adding the word unique, or the trend setting aspect of question papers is more inclined towards ortho is something which we don't practically do anything on the patient at a UG level. Whereas rest, you take endo, you do something, you take operative, you do something, pedo, you do oral surgery, you do prostho, you do, okay, whatever it is, like any subjects, any clinical subject, you're going to do something on the patient. But ortho is something which we don't do on the patient. Okay, that's the first important thing. So whatever you do in ortho, whatever you read in ortho, it's an imaginary part. So what happens in the latest examinations, like for example, you see the latest INICT or latest NEET, that is NEET 2022 latest paper, or like the upcoming 2023 paper. So ortho is more of an incline towards a clinical scenario. They're just giving a clinical scenario. It's not a heavy hi-fi clinical scenario, but a basic common sense or like the basic common sense related clinical scenario which requires your imagination to be kept in a practical point of view. So that requires more work to be done for an ortho. Okay, so among all the clinical subjects, I vote you need to work more towards ortho, and next comes is the prostho, because prostho, whatever we do is just hardly a 10% of prostho. CD we do, or also RPD we do. So this is the level of clinical aspect at a UG level. So the imaginary part will be more like, so subjects which are having imaginary part more, you need to work more, you need to imagine more, you need to get that into a practical imaginary part, then you have to read. So that is the trickiest part of ortho, followed by prostho. Ortho is going to stand first according to me, the next comes with the prostho, and I promise you my team, my ortho team is going to make the things cool, composed, simple with their experience and with their smartness. So ortho drift. So what is the drift of ortho 5 years back to 5 years now to the present day is, previously the questions are like an open-end questions or something called as a single line questions. Okay, facial index, normal value is what? Facial index is given by. Okay, so this syndrome is going to have what is the treatment plan for this habit? So these are the something like, or according to this particular classification, what is something? So these are called as an open-end or a single liner based question that does not require any clinical knowledge. If you just know your concepts and you can just straight away hit the right answer. But when you're coming to the present scenario, most of the times they are linking with a clinical scenario, giving a cephalometrics, giving a radiograph and asking, giving a clinical photograph and asking a clinical based question. But it's simple, but you should know, you should have that clinical common sense to judge these questions. So that is the drift of the questioning of ortho. So that's what, like, whatever materials which are available for us in digging out and learning ortho may not be helpful in the same way, in the same pattern to handle a question in the examination. That is the toughest part that ortho questions are coming and the students are facing. That's what my plan. Like, you need to learn those things, but you need to apply those things. That's what the second part where our mentors will be focusing in the upcoming few days. So this is an outline of ortho. Okay, so how many questions are coming from INICT, how many questions are coming from NEET, decent weightage, subject which is unique, so you need to work hard, you need to imagine more, you need to learn better, and you need to take the help of mentors here. There is a drift of questioning 5 years back to the present question papers, lots of drifting of the questions. So for this you require an application power and you require some sort of hard work from your side when you're reading subjects like ortho and particularly prostho, the next subject. Okay, so now with my knowledge over last 10 years, so I have listed out few important topics which has to be done, and of course we have prepared lots of videos, lots of content on these things to make things easy and simple for you. Okay, so these are the list of topics like growth and development, etiology of malocclusion, development of dentition, growth rotations are frequently being asked in INICT related to PGI people. They love to ask questions on growth rotations. Look, whenever the PGI people are preparing a question paper, so that you can just predict these tricky growth rotation based questions which are very, very difficult for a UG student to understand. And next comes the occlusion, classifications of occlusion. These subtopics are again integrated to your prostho and DA. And orthoradiography related to radiology, skeletal maturity indicators you're familiar with. Cephalometrics is one of the damn important thing, and followed by the study models, model analysis, diagnosis part, the tooth movement basics, anchorage, retention relapse. Okay, preventive is important, interceptive is important, removable appliance important, fixed appliances are important, biomechanics is important, myofunctional appliances are important. Of course, these are the important topics that you need to stress, and this information is collected from the questions which are given in the last couple of minutes. You have a basic skeleton which is done by most of the most of the students or most of the mentors, but apart from the basic skeleton, I have added few more important things which are frequently asked in the last 5 years, which are uncovered or which are being ignored or which are being neglected in many standard MCQ books. Okay, so my focus is to cover as much stuff as possible. So this is what the plan that we are coming out with. So next comes, I don't know the goal of a particular student, but I know that you can stick on to your basic books, like what you have referred during your UG level for your basic reference. Like whenever you want to refer something, whenever you want to understand something better, it's okay, like because a few of you have done your final year recently and few of you have done your final year long back, but it's okay. If you want to refer, you can refer whatever book you have done in your final year. That's okay, no objections. Okay. And in most of the situations, you no need to refer a book because most of the content is already being discussed or well explained by the mentors with lots of ease and everything on your regular video session. So you don't need to break your heads referring books XYZ. But my suggestion, if you want to really refer a book for a particular topic and if you're focusing on INICT, okay, so normal books that most of us will do is like either Balaji or textbook of Ortho by Gauri Shankar sir. So these are the books that we all regularly refer at a UG level. But if you want to refer or understand something, you can go with those books. But if you are focusing on INICET, if you're focusing on INICET, then definitely this book is the book should be referred because they are very, very high yield points, and it's a PG level book. But of course we don't have any other option. Okay, there were so many straight away questions from this particular book in so many exams of INICET. Right, so if you are planning for INICET, so for Ortho, to get a good scores, this book reference is mandatory. So wherever you feel like you want to refer, you can go back and check this book and refer. So next, to solve an MCQ, okay, so I like most of you, you can plan accordingly, the basic books, whatever you're going. But if you want to be more organized, okay, I recommend any of these books to be followed. Okay, either Dentist by Dr. Gauri Shankar, or either MCQ in Ortho by Sharan sir. Okay, so any of these books are very, very good. The books are very huge. Like for example, Sharan is a very huge book for an Ortho. Okay, there are few people they are going to do these books because it is more of an integrated to other subjects also. But as I said, like if it is a repeater, yes, of course, you have to read a number of books, but it is an intern. As there is a time limitation, I strongly recommend you to be perfect with at least one single proper book. Like either you can take Dentist, or either you can take Dental Pulse. Okay, Dental Pulse. I prefer like Dentist is going to be a better option for Ortho because it is the main author of Dentist is Dr. Gauri sir, and he's an orthodontist which has a vast experience, and definitely I strongly recommend to go with Dentist as a better option than the Dental Pulse, keeping in mind about the content, the organized content that is there in the Dentist. And the next comes is like, of course, if you want to finish the things fast, of course, the PP book volume 1 has your Ortho in combination with Pedo, and I strongly recommend you to read them probably in the last 2 to 3 days of the preparation, because most of the important memory based things, tables, values to be done, it's more often like a short notes of some 50 odd pages that has to be done, that has to be revised. So if you ask me what has to be revised to Ortho, very frequently I can simply say PP book volume 1, you go for Ortho, revise the tables, revise the numbers, revise the scientist names, whatever it is, everything that is memory based is clearly given in the book. So you can keep this book for revision, not for the first round of reading. Okay, you can keep this book for reference. That is preferably if you are planning for INICET, or if you're simply targeting your NEET MDS, okay, want to make your preparation simple, you can just go back to your basic books, like whatever you have done. That can be either Balaji, or that can be either textbook of Ortho by Gauri Shankar sir. Any of these books are basic references. Those are more than sufficient. If you want to be perfect, I recommend Dentist followed by DP. Okay, it's completely your wish, like which is accessible, which is available for you. You can decide basing upon that. If both the books are available, I strongly recommend to go ahead with the Dentist. Okay, whatever book, the contents will be almost same. That's what I regularly interact with the students, I interact with the authors and everything. Like we regularly talk, the contents of the books will be same. Okay, it will be same, whatever that is there in the DP, whatever that is there in the Dentist, Sharan, whatever it is. Like and the mode of teaching of the coaching centers will always be the same. They always teach the same content, but approach of the content varies. That can be from the book, or that can be from the mentor, or that can be from a particular coaching center. So the contents, we are going to teach Ortho only. We don't teach something like extraordinary Ortho. There's nothing called as extraordinary Ortho. We teach Ortho, they teach Ortho, everyone they teach Ortho. So similarly, I'm talking about books, like if you have both, go for Dentist as a first priority. If you don't have both, like you can go for either Dental Pulse or Dentist basing upon your wish. And there will be few topics if you do from Sharan that could be extraordinary. but you check out the availability of the book in your particular college, library, or your study areas, or anything. Like we'll talk about that particularly on our respective groups when we start the proceedings. So this is the outline of the books to be referred, and I strongly recommend any one of this for interns particularly. So rather than digging out two books, breaking your time, and like unable to complete the revision and everything, you stick on to one book. Repeaters, if you have more time, you can. Reference also, as already discussed, so go ahead. So coming to the checklist, so you have smart videos. For most of the topics, you have smart videos, and they're well organized with lots of diagrams and lots of imaginary clinical based scenarios and everything, whatever that is possible. There are few mentors like they have added MCQs also, so lots of stuff is there. You need to spend more quality of time in checking out the smart videos. Okay, so once you're done with the smart videos, I want you to jump into the MCQ solving. Okay, so MCQ solving. Okay, so MCQ solving, I want you to start the MCQ solving. Either you can take a book, already discuss what books to be done, and preferably we are going to provide the question bank also on the website. So I think the question bank is open. It is not open for all the topics. We are slowly filling the question bank. The recent update on the website, apart from your topic specific exam, there is something called as question bank, where you can solve question by question, something like how you solve the questions in DP, how you solve the questions in dentist, how you solve the questions in MCQ book. You can solve the questions similarly in website also. There is something called as question bank option on the website, which is updated 5 days back. So I want you to solve the questions, like solve the questions, understand the concepts, know the mistakes. Then I want you to attend the evening activity. So every day we'll have an evening activity. Okay. Evening activity will not be there whenever there is a pro live session, or whenever it is revision. We don't have any evening activity. Whenever there is an exam, whenever there is a pro live session, or whenever there is a revision, we don't take an evening activity, or else regularly you will have 30 to 40 minutes of activity. The main motto of this activity is to exchange the energy and give some motivation every day, so that you're going to make your preparation active. Okay, so this is going to be handled by either Gauri Shankar sir or Usha ma'am, the evening activity. Then fourth comes is, I want you to give, like after finishing these things, okay, I want you to give your topic specific exam on the next day before you start, or you want to give on the same day, you can give it, or topic specific exam will be there on ortho folder after clicking on the take exam. So you can give that ortho topic specific examination. So these are the four things which are mandatory for anyone, whether it's a repeater or intern or housewife, mother, clinician, whatever it is, wherever you're from. Okay, you're part of Conquer. I want to make sure you check out all these four things on the ortho. So this is the mandatory checklist that you have to do. So apart from this, you'll have pro live classes of ortho. Preferably we are planning to have 3 to 4 pro live classes. Okay, and the schedule of ortho will be posted on your respective. So this is an outline of ortho, what to be done, how to be done, where to be done, and XYZ stuff. If you have any doubts, you can just drop your doubts on your comment box, so that we are ready to help you out. Even if you're a student of MDS Conquer or not, we are here to help you out in all the ways. So make sure ortho is unique, ortho is tough, ortho is interesting. So when someone is unique, someone is tough, someone is interesting, so first thing what we have to do, we start loving the people. Okay, so then they'll be more comfortable, then they will be more easy, then they'll be more close to us. So I want everyone to love ortho for the upcoming 15 days. Okay, so it's going to be interesting journey, and let's enjoy this particular part with a team MDS Conquer. Signing off, Srikanth from team MDS Conquer. Bye bye, take care.